Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
Hello everyone, Dr. Jeffrey Boone here from the Boone Heart Institute in Denver. Wanted to share with you a few moments some practice inspiration ideas that might enhance your performance as well as your health. BooneHeart.com, Boone Heart Institute in Denver, to get more information about our program. I wanted to talk about stress, but link it more to the physiologic aspects of stress. That tends to be our main focus in our health practice, of identifying stress as a cardiovascular risk factor. But oftentimes when you know about that and control it, it can help you in other aspects of your practice. Now, mental stress. Interestingly, I found in dentists and in the dental field a unique dichotomy in blood pressure. Blood pressure is probably the easiest way to identify the surges of stress throughout the day. We all feel tingling of our skin and redness of the face and the adrenaline surge. But it's hard to measure those biochemically and also clinically in a useful way. Blood pressure, however, is an easy marker that travels along with heart rate with all of your stress variances throughout the day. For example, my blood pressure and heart rate ought to be a little higher right now because I'm activated and adrenalinized talking with you. Now that can be a problem, and I've noticed in our evaluation of dentists in our executive preventive cardiology program that there's an unusual sort of plague of what I would call hidden high blood pressure. Now that fits also with your goal in my advice to you of embracing abnormalities. Now most of us, especially us males, don't like to be told there's anything wrong with us. And so it's easy to work with your doctor and try to say, oh, I really don't have blood pressure, or that was just an isolated, elevated event of my blood pressure. And that's a big mistake medically. So in the dental community, I found a big surge of blood pressure because you got patients all over the office in chairs trying to really meet the psychological and the dental needs of your patient. A lot of pressure on you, and often that will be translated not just to a little bit of blood pressure surge, but a great blood pressure surge. So at the Boone Heart Institute, we evaluate that very extensively. Most people do physical treadmills to look at your heart, but exercise is actually very good for you. So most of the time you actually even hide blood pressure abnormalities during a treadmill test. We do mental stress testing, which you can get in very detailed fashion at the Boone Heart Institute in Denver, but very simply in your office, just take your blood pressure, have your staff take your blood pressure when you're under the worst stress of the day, and then embrace that abnormality, because traveling with that blood pressure are 9 or 10 other cardiovascular dangers. When your blood pressure surges, just like the blood pressure being elevated due to adrenaline, part of the God-given response of adrenaline is to make your blood clot quicker. And that helped us when we're battling bear claws and tomahawks and broadswords. Our blood clotted quicker, and that was actually a genetic advantage and a part of the stress response that was protective 1,000 years ago. But in today's world, most heart attacks and strokes are clotting surges around fractured arteries. So what happens is when that blood pressure surge, if your surge is higher than 140/90 during stress, embrace that, because your clotting is increasing. During that time, there's a surge of blood pressure along the linings of your arteries, which can fracture plaques and cause plaques to grow. Also, that same adrenaline that is surging your blood pressure and heart rate fouls up the electrical system of the body, causing arrhythmias, causes palpitations, skipped beats, causes the heart muscle to overwork and become stiff and to become thickened and hypertrophied and even stretched to cause problems down the road. It even causes, interestingly, as your body is under stress, the kidneys will actually get rid of potassium, which is a wonderful chemical for your body, in order to hold on to sodium. Now, sodium travels with water, and therefore part of this battle response is to keep your blood volume high, which then keeps you from bleeding to death if you're tomahawked. But in today's world, all it does is cause your potassium to drop, your sodium to be utilized along with water to maintain more fluid volume, and causes high blood pressure. And then also the electrical system of the heart is a bit fouled up if your potassium levels are low. So all of those are happening by just this little blood pressure surge that you might pick up in your office. So measure it when you're under stress. You can even stress each other out, as we do in our practice using something called a serial subtraction. We do serial sevens. But if you don't like the person, you want to make it really difficult, do serial 13s from 777 down to 0. We test the NFL, and when we test the Oakland Raiders, we often have to use serial 1s, 7, 6, 5. No, you get the idea. Make a little stressful task, check your blood pressure, and embrace the abnormality. Oftentimes, then you can see how good you can make your blood pressure by taking 5 to 10 deep breaths. The way we do that is have you, and it really sort of simulates relaxation, biofeedback, prayer, that sort of thing that might meditate your blood pressure down. Take 5 deep breaths, in through the nose, out through the mouth. Do that 5 or 6 times deeply while they're taking your blood pressure. And oftentimes you'll see that your mathematics blood pressure, your mental stress blood pressure, might be 160, 170, 180. And when you take 5 or 10 deep breaths, it'll drop 40 or 50 points. So you know that when you're stressed in the future, oh my gosh, my blood pressure's up. Oh my gosh, all these other things, shear stress, clotting, electricity, muscle changes, all types of things are happening. Then you know, look out the window and take 5 to 10 deep breaths, and that's going to be better than a medicine. Now, my goal medically is to find some of you do need a medicine. We found a number of dentists that actually need a medicine. The group of medicines you want to look at, and I'll close with this tidbit of information, ACEs, angiotensin-converting enzyme inhibitors, and ARBs, angiotensin receptor blockers, especially the ARBs, any drug that ends in artin, olmesartan, losartan, valsartan, all those drugs, no side effects. And they help the heart by blunting the surge of blood pressure, but not bottoming it out when you don't need it. I'm not a big fan of beta blockers and diuretics because they lower the blood pressure all the way across the board. These drugs tend to react and embrace those drugs. They're just like sunscreen. You don't take them because you're sick. You take them to keep from getting sick. And that's where I come in to evaluate, do you really need drugs like that? And some need more, some need less. No problem with that. Let's just make your blood pressure perfect. Just a month ago, we're usually a decade or two ahead of what the recommendations are for the world, but just a month or two, even the hypertension guidelines changed, meaning lower is better. And they made 46 million new people have high blood pressure, which actually is a good thing to pay attention to that. The best blood pressure to have is one that barely keeps you standing. And that's the truth. Now, if you have to even accomplish that with a drug, the artins and then the other ACE inhibitors end with pril, captopril, lisinopril, enalapril. Those are 2 branches of drugs that are very safe. They work when you need them. They prevent constriction of the blood vessels. And you want to open them up and deliver more water on the garden, the rose garden being your heart, your brain, your heart, and your kidney, but under lower pressure. So we want more flow, but less pressure, and even medicines can help in that regard. And we've even found that our multi-immunity vitamins have reduced the stiffness of the heart caused by stress by about 12% a year. So there are a lot of even non-drug things that you can do to optimize this process. So hopefully that helps, and you can almost make it a fun part of your day to realize, oh, I better work on these things to optimize my stress response, prevent disease, and I think in the process you'll probably be happier and healthier to take care of your patients. So thanks for being with us today, and call if you have any questions.